This is the overview of the Cardiovascular Blood Sugar Profile, the Laboratory Interpretation Guide from Destiny Well. This profile looks at three key interrelated elements: lipids, which include cholesterol, and the major subtypes of cholesterol: LDL, often called bad cholesterol, HDL, often called good cholesterol, and triglycerides, which are derived from fat metabolism and related to sugar intake. It does blood sugar testing, and until recently, we didn't know how closely blood sugar was associated with cholesterol problems and with cardiovascular risk. Blood sugar leads to increased inflammation when the sugar levels are high, and inflammation itself is a cardiovascular risk factor. So markers of inflammation are also included in this test. These three are closely interrelated and all have a lot to do with your cardiovascular risk. If your LDL bad cholesterol is high and your inflammation markers are low, you are at moderately increased risk of heart disease. If your inflammation markers are high and your cholesterol is low, you're at moderately increased risk. But if you have both elevated lipids, abnormal LDL cholesterol, and an unfavorable profile, and increased inflammation markers, then you're at substantially increased risk. We've known for a long time that diabetes doesn't just increase your risk of cholesterol by adding, it multiplies your risk of cardiovascular disease. So we often will treat diabetics much more aggressively. But now we're understanding that prediabetes and mild elevations of blood sugar and insulin resistance are root causes for many different things, including heart and blood vessel disease, but also for cognitive decline, macular degeneration, and many other factors. Insulin resistance is a key root cause risk factor for many different problems. It increases cardiovascular risk, it increases risk of Alzheimer's disease, it increases risk of macular degeneration. But when your glucose metabolism is poor, it also changes your hormone metabolism. So in men, increased aromatase activity in fat tissue converts testosterone into estrogen. And also in women, increased activity in an enzyme called 21-liase converts estrogen into testosterone and leads to unwanted masculinization symptoms such as increased hair growth and deepening of the voice and other problems. There's evolving knowledge in terms of how lipids work. We've known for a long time that diabetes is a substantial risk factor for heart disease. It doesn't just increase your risk of problems, it multiplies your risk. But now we're finding out that lower levels of insulin resistance, prediabetes, and those conditions also have a lot to do with inflammation, and they have a lot to do with your lipid profiles. In this profile, we look at your overall cholesterol, LDL, HDL, and triglycerides, and we also do some calculations that will give us reflections of how particle sizes are in LDL and other kinds of risks. In our most advanced profile, the Cardiovascular Plus profile, we actually measure these and some other more esoteric but critical risk factors as well. Another good thing about the Destiny Well cardiovascular and blood sugar profile is it can put you in charge of ordering this test when you want it. Lots of times insurance companies say, well, if your cholesterol's fine, you don't need to check it but every 5 years. But a lot of people, a lot of my patients over the years really want to see their progress. They want to know if they fell off the wagon and they had nothing but Christmas cookies for a few months, whether they're worse, and they want to know if they've really been dieting and paying attention and exercising and losing weight. They want to see what's up with their situation. So this puts the power back in your hands and lets you take control of your health through evaluating your blood sugar, your inflammation markers, and your cholesterol values. When people develop insulin resistance, that often leads to metabolic syndrome. Metabolic syndrome is a condition that's said to be present when you have 3 of these 5 things present. You have elevated triglycerides, you have elevated blood pressure, you have increased fat around the middle, which shows up with increased waist circumference, also called increased visceral adipose tissue, because it not only shows up in the belly on the outside, but it's in the inside of the abdomen and also around the heart. Elevated blood sugar is another factor, and then decreased HDL good cholesterol, values less than 40 in men and less than 50 in women. Any 3 or more of those give you a situation where you have metabolic syndrome. When we think of regulation of blood sugar, we think of insulin. Insulin is a key factor in keeping blood sugar from getting too high, but it also helps insulin get into the cells where it can be used. However, other hormones are interrelated and closely regulate blood sugar as well. Cortisol, for instance, tells the body to make sugar and make sure there's plenty of it around all the time. And when cortisol starts to fail, or in emergency situations, then hormones like adrenaline and noradrenaline come into play. They also raise heart rate and blood pressure, but they do raise the sugar as well. Sugar is a vital fuel for cells. Most cells, especially the brain and the heart, need sugar to run on. They can learn to metabolize lipids more effectively and burn them as well, but sugar on a day-to-day basis for most of us runs the system. In functional medicine, we call insulin resistance type 3 diabetes. When there's enough sugar, but it can't get into the cells, this can lead to cognitive decline of the Alzheimer's type. Sugar also affects hormone metabolism. When we get insulin resistance, we get visceral adipose tissue around the middle. That leads to an increase in the enzyme called aromatase. In men, aromatase converts testosterone to estrogen, which leads to increased breast tissue and other changes. And in women, increased aromatase leads to higher levels of estrogen. Now, those higher levels prevent women from getting osteoporosis as much, but it comes at an expense because higher estrogen levels, especially if they're unopposed by progesterone hormone, and that there's not enough of that around, they get more breast cancer and uterine cancer risk. So all these hormones are interrelated. We think of insulin, but cortisol and catecholamines and even the sex steroids all relate to sugar metabolism. At Destiny Well, we define laboratory ranges in a sophisticated way. We use the standard ranges, represented by the blue bar here, from each reference lab that does a particular test to define the lab high and the lab low. If you have thyroid test results that are too low based on the lab's formal norm, then you have a diagnosis of lab low thyroid function or hypothyroidism. Similarly, for glucose, if you have a lab high blood sugar of over 126 on 2 occasions, then you meet the formal diagnosis criteria for diabetes. That's needed to make a medical diagnosis. But at Destiny Well, we think that there can be a lot more nuance. We believe that there's often an optimal range based on what we've found going forward helps people to live the healthiest lives, to be the healthiest, and to avoid disease. We triangulate this with the medical literature, with other people's standards, with our clinical practice experience, and all the different data points we can get, so we can come up with what we believe is optimal for a particular test result. Destiny Well also, in the red bars here, will define a Destiny Well high and a Destiny Well low. These may or may not line up exactly with a laboratory high or low, because sometimes we think that the range can be higher or lower, or that it needs to be different. And in between the optimal and the green bar and the low and the high in the red bars, we have orange zones for moderately high and moderately low. They're not quite optimal, but they're not in the high or low zone. Hemoglobin A1C, or glycohemoglobin, is a critical blood sugar test. It was invented a number of years ago, and since then, diabetes care has been revolutionized. It measures how many sugar molecules are stuck onto the hemoglobin in red blood cells. And sugar molecules get stuck onto all sorts of proteins and cause glycation or damage to those molecules. So we can measure and get an average of what's going on with the blood sugar for about 3 months. Because typically red blood cells live for about 3 months and then they're recycled for parts. So if you measure how much sugar is stuck onto the hemoglobin molecules, it gives you this 3-month average. Now, if you're in a highly stressful situation, or you have abnormal red blood cells, or you have a lot of oxidation in your blood, then red cells don't live as long, and so you're getting maybe a 2-month average of that. But overall, we say this is a 3-month blood sugar test, and there are different ranges. So lab normal for us is 4 to 6% from the reference laboratory we're using. And we think that an optimal value is somewhere in the range of 4.6 to 4.9. As you get down to 4.2 to 4.5, you may be running your sugar a little bit low. Now that decreases cardiovascular risk, but when you have a sugar in that low range, you may be using more cortisol all the time to keep it there. And sustained high levels of cortisol in the 4.2 to 4.5, or even in the lower range of 4 to 4.2, High levels of cortisol can disrupt your normal bowel flora. They can shrink key areas in the brain like the hippocampus and lead to adrenal exhaustion and dysfunction of the hypothalamic pituitary adrenal axis, the thing that regulates your cortisol and a number of your other hormones, as well as your day-night cycles. Now, elevated glycohemoglobin, 5 to 5.6, is considered abnormal, and over 5.7 is destiny well high. Now, getting up above 6 is definitely in the lab high range. It's important to know that our ranges for both glycohemoglobin and fasting blood sugar are for non-diabetics. People with diabetes, especially those who take insulin or other medicines that significantly lower their blood sugar, are at increased risk of hypoglycemia when they have things that drive their sugar down. So if they run their glycohemoglobin or their fasting sugar in very low ranges, then they're at risk for hypoglycemia, which can lead to coma and death. And so often we build in a bit of margin of safety and try not to run the glycohemoglobin and the sugar as low with people who actually have diabetes. So if you don't have diabetes or you have prediabetes and you're using diet and exercise and lifestyle modifications, then the targets we list are for you. If you do have diabetes, then you need to work even more closely with your personal physician or medical providers to get those levels in a range that is optimal for you as defined by your care team. Fasting blood sugar has long been a way to evaluate your glucose metabolism. It has to do with your basal insulin secretion, how much insulin you put out overnight to control the blood sugar that is manufactured by your liver and your metabolism all the time. Our laboratory partner calls their reference range 60 on the low side and 105 on the high side. At Destiny Well, we call low anything less than 70, and we think the optimal green zone is between 80 and 93. When you get below 80, you don't have frank hypoglycemia where you go into insulin shock and coma, but you do get edgy or hangry where you're hungry and angry at the same time. Your performance may be suboptimal, and you may also be relying on high levels of cortisol to maintain your blood sugar all the time. If you have continued high levels of cortisol, it does a number of things. It disrupts your circadian rhythm. It leads to exhaustion and imbalance of what's called HPA, or hypothalamic pituitary adrenal axis. That's the communication between the area in the brain called the hypothalamus, and the pituitary gland in the brain, and the adrenal gland that controls your stress hormones. If that cortisol level is too high all the time, then it may shrink your hippocampus, which is a memory area. It may disrupt your circadian rhythms, and it may lead to a number of other problems. And if your sugar is mildly high at 93 to 100, you're getting close to prediabetes, and your average glycohemoglobin is probably a little higher, and you're sticking more glucose molecules onto proteins and damaging them. And when you get over 100, you're into prediabetes. These are all values if you've been fasting for 8 hours or more, and they have to do with the diagnosis of insulin resistance, of prediabetes, and diabetes. C-reactive protein is a protein that goes up when there's inflammation in the blood. Not only is it a marker of inflammation, but the CRP itself is actually a damaging factor. When we look for low levels of chronic inflammation rather than high levels of inflammation, we look at a test called high-sensitivity C-reactive protein that brings out the details of what happens with low-grade inflammation. Regular C-reactive protein will go way up with diseases like rheumatoid arthritis, lupus, and chronic infections. But high-sensitivity C-reactive protein has a lower set value, and those ranges are more looking for chronic low-grade inflammation that's associated with everything from increased cancer risk to increased risk of Alzheimer's to more migraines to more depression, and it's especially useful in evaluating for cardiovascular disease. The reference range from our laboratory partner is 0 to 4, with values over 4 being abnormal. We find at Destiny Well the optimal range is less than 1, and many cardiovascular protocols use this cutoff as well. Values of 1.1 to 3.0 are mildly elevated, and values of over 3 are definitely associated with increased cardiovascular and other risk. Total cholesterol is the sum of all the different types of cholesterol. LDL, bad cholesterol, the HDL, good cholesterol, and other fractions like IDL and VLDL cholesterol. These together comprise total cholesterol. Cholesterol serves a number of functions in the body. When it goes up, it sometimes is an inflammatory reaction, and the cholesterol is buffering and protecting the body from oxidative damage. Cholesterol is also important for the synthesis of hormones. It's the precursor for them, and also for things like vitamin D, which are steroid-related molecules that the body can synthesize in the presence of sunlight. We set our cholesterol norms a little higher than some people. We think that our laboratory partners range of 0 to 200 is fine, but our optimal range we believe is in the 150 to 200 area. This gives you enough cholesterol for your membranes to function, enough to use as hormone precursors and to make vitamin D, but not too much. We think that 201 to 239 is mildly elevated, and values over 240 are generally elevated to the problem range. Similarly, 111 to 149 is in the mildly low range, and we call cholesterol less than 110 too low, because you're probably in a range where you're not making enough steroid hormones, your membranes may not be as healthy, and you can get into other problems. Triglycerides are another fat in the blood. They're closely tied to your sugar metabolism. The normal for our laboratory partners reference range is 0 to 200. At Destiny Well, we like an optimal range of 60 to 100. Triglycerides are important for your fat metabolism. Values over 100 are associated with increased problems, and your HDL good cholesterol is often going down when that happens, and we call greater than 150 abnormal, as do some of the other major medical societies and groups. Values of 36 to 59 are mildly low, and when your triglycerides get less than 35, then they think they're too low, maybe representing some problems with your metabolism. So carbohydrates and alcohol raise triglycerides substantially. Sometimes the high triglycerides runs in families. And then if your thyroid function is out of balance, if your thyroid is too low, your triglycerides will often go up significantly. And if your thyroid function is too high, if you have hyperthyroidism, then your triglycerides may actually go down lower than you want them. LDL cholesterol is called bad cholesterol. LDL has been associated with a lot of cardiovascular risk, and many times LDL is what's targeted for therapy with drugs like statins or from diet and other programs. Our laboratory reference range is from 0 to 160, and at Destiny Well, we think somewhere in the 70 to 120 range is optimal. On the lower side of that, if you have many risk factors or you've had previous cardiovascular problems, and on the higher side of that, if you're not having problems. We think less than 40 is too low, where you may not actually have enough cholesterol to synthesize things like vitamin D and to keep your membranes healthy. And then over 160 is definitely too high. We call 121 to 160 moderately high and 40 to 69 moderately low. Now, how your LDL relates to your overall health not only has to do with LDL itself, but it has to do with the condition of LDL, whether the molecules are oxidized and more damaging, or whether the LDL particles are big or small. And some of our other calculations and our other profiles will get into that. But these are the ranges that we set. You should know that if you have advanced cardiovascular disease, if you've had a heart attack, if you have multi-vessel disease in your heart, then your cardiologist or we might say that even lower ranges are appropriate to get down under 70 or down under 60. So those are considerations sometimes managed by specialty physicians, and they're outside the realm of what we generally talk about here at Destiny Well. But you may see other people recommending this for good reason, and that would be something to work with an individual physician on to find out what's best for you. HDL cholesterol is also called good cholesterol. The values of HDL are different in men and women, and in men, the normal laboratory reference range is anything above 40. They don't really define a too high range. At Destiny Well, we think values around 60 to 90 are probably optimal, and 41 to 59 are only moderately low, and many people are okay in this range. When you get below 40, you definitely have increased risk. HDL molecule takes cholesterol back from the blood vessels in the body to the liver for reprocessing. So it's a way to keep cholesterol from building up. Values over 90 sometimes could potentially be a problem because we're finding out that sometimes people don't clear HDL from their system. So once it's filled up with types of cholesterol that are supposed to go back to the liver and get reprocessed, instead of actually having receptors and going into the liver, it's circulating around and around. So values over 90 look like they may be associated with dysfunctional or not fully functioning HDL in some people. So we think that up to 90 is probably good for most people. Over 90 raises that question about whether the HDL is functioning normally. But values under 40 are definitely a significant problem. In women, HDL performs that same function of taking cholesterol back from the body and the blood vessels to the liver for reprocessing, but the values are slightly different. In women, the HDL should be over 50. We still believe the 60 to 90 is the optimal target, and 50 to 59 is in the mildly low range, with values over 90 possibly indicating dysfunctional or not fully functioning HDL, where it's high in the bloodstream, but that's because it's not being cleared and doing its job of taking cholesterol back from the body to the liver for processing. Non-HDL cholesterol is a calculated value. It's a simple equation subtracting the HDL good cholesterol from the total cholesterol. It also, in addition to the LDL bad cholesterol, includes fractions such as IDL and VLDL, intermediate density lipoprotein and very low density lipoprotein. Both of these are very high risk for cardiovascular risk and are damaging to the heart and blood vessels. The calculated normal for this is between 0 and 190 for a non-HDL, but optimal at Destiny Well is in the 100 to 130 range. Values of less than 100 may indicate that you don't have enough total cholesterol to help your membranes and your hormone synthesis. 131 to 160 is mildly elevated, and values over 160 probably are higher risk, and so Destiny Well has set their too high range at anything over 160. The triglyceride to HDL ratio is another calculated ratio that we find to be very valuable. Values over 4 are considered to be laboratory high. But we've also found that setting the values lower is helpful. Our optimal zone is 2 or under, mildly elevated 2 to 3, and elevated greater than 3. If your number is greater than 1.5, it predicts that your LDL particle size is going to start to go down. Smaller LDL particles infiltrate the blood vessels and cause disease more readily than larger LDL particles. So this is a way to get a glimpse at your LDL particle number in addition to ways that would measure it directly in more advanced profiles. We really want this ratio down around 2 or less, and over 3 is clearly associated with increased risk of heart and blood vessel disease. At Destiny Well, we've been extremely fortunate to find some amazingly good coaches, people with backgrounds of success in varied fields who bring all sorts of resources and talent and skill to help you. These folks have many years of clinical experience, and they know how to be of assistance at every step of the way, from motivation to connecting you with the right resources to finding things that you need to get you on your journey. To learn more, go to destinywell.com/coaching to meet our team and find out how they can be of service to you.